We all want to think our puppies are perfect, but sometimes it can be hard to know if your puppy is truly healthy. If you just adopted a new puppy, there could be some red flags that you're not aware of. That's why in today's video, we're going over 6 red flags that your puppy needs to see a vet. If you have a puppy, please make sure you stick around for this one. And for my regular viewers, if you want to support me, just hit the like button and subscribe to the channel. Really appreciate it. The first red flag is that your puppy has a runny nose. Runny nose or rhinitis is usually caused by an infection and is one of the most common reasons that vets see dogs. Now, they see them for all sorts of reasons, including exposure to smoke, allergens, irritants, and infections. Some examples of irritants would be perfume or cleaning chemicals. And as far as infections go, they can be caused by a virus, bacteria, or even fungi. Now, in most cases, you should be able to tell whether or not your puppy is breathing normally, because if they are having trouble breathing, it could be a sign of something serious, such as pneumonia, heart disease, or collapsing trachea. Also, if your puppy has a runny nose, it's also important to check their eyes to make sure that they do and have any discharge coming from them as well. This is because discharge from both their eyes and their nose could be a sign of an upper respiratory infection. Another red flag is if your puppy has sneezing fits. Now, this could be for a number of reasons, including irritation from smoke, dust, or other allergens. But excessive sneezing could also be caused by something more serious, such as nasal mites or cancer. Nasal mites are a type of arachnid that lives inside the dog's nasal passages. They can cause intense itching and inflammation, which can lead to excessive sneezing. These parasites are common in dogs, but thankfully they're not contagious to humans. Cancer is another possible cause of excessive sneezing in dogs. And this is especially true if your dog is a brachycephalic breed, meaning they have a short nose or flat face. Now, if your puppy has a runny nose or sneezing fits, you should take them to the vet so they can determine the underlying cause and receive the necessary treatment. No, 2 is if your puppy isn't eating or drinking. It's normal for puppies to go a day without food sometimes, especially if they're full from the day before. However, if they're refusing to eat or drink for 2 days in a row, this could be a cause for concern. There are many reasons why your puppy may not be eating or drinking. Some common reasons include gastrointestinal issues, stress or anxiety, dental problems, a recent change in diet, or they could simply be spoiled and only want certain foods. In more severe cases, loss of appetite or thirst could be a sign of something more serious, such as a fever, parasites, liver disease, diabetes, kidney disease, or even poisoning. So if your puppy hasn't eaten or drank anything for 24 hours, I recommend taking them into the vet. The third red flag is if your puppy has diarrhea. Soft or bloody diarrhea can be a sign of many different things, including a simple stomach upset or something more serious like parasites, bacterial or viral infection, inflammatory bowel disease, or even poisoning. Diarrhea can also be caused by a sudden change in diet or eating something that they shouldn't have. In most cases, a bout of diarrhea will pass within a few days. However, if it persists or you notice any blood in the stool, I highly recommend you take your puppy into the vet. A quick note: if your puppy is experiencing diarrhea along with vomiting, make sure that they have water available at all times, because this can quickly lead to dehydration. Red flag no. 4 is if your puppy has lost appetite and has started vomiting. Now, as I mentioned before, loss of appetite or not eating can be a sign of many different things. But when paired with vomiting, it can be more serious and could lead to dehydration. Like I said, loss of appetite could be a result of a stomach bug, worms, or even stress. On the other hand, vomiting could be caused by an obstruction in their digestive system, which could be life-threatening. Vomiting could also be a side effect of a medication or something that they ate. In some cases, vomiting could be a sign of something more serious, such as parasites, inflammatory bowel disease, or even cancer. It's important to pay attention to how often your puppy is vomiting. If they've only done it once or twice, it might be a one-off incident. But if they continue to do it excessively, then you should take them into the vet. Red flag no. 5 is if your puppy has limped or has difficulty walking. If your puppy has difficulty walking or seems to be favoring one leg over the other, this could be a sign of pain or injury. If your puppy was recently playing or exercising and then suddenly starts limping, they may have injured themselves while playing. This could mean that they have a sprained or torn ligament or tendon or possibly even a broken bone. On the other hand, If the limping has been going on for a while and you in to remember any incident where they could have gotten hurt, this could be a sign of something else. Limping could be caused by hip dysplasia, elbow dysplasia, pancreatitis, osteochondritis, dissecans, or even a vitamin D deficiency. All of these conditions can cause pain and inflammation in the joints, making it difficult for your puppy to walk. So if you notice that your puppy is limping or having difficulty walking, it's important to take them into the vet so they can determine the underlying cause and receive the appropriate treatment. And the last red flag is if your puppy is lethargic. If your puppy is lethargic or lacking energy, this could be a sign that they're not feeling well. Puppies are naturally very active and playful, so if they're suddenly not interested in doing anything, this could be a cause for concern. Lethargy can be caused by a number of different things, including being overweight, heat stroke, extreme cold, dehydration, exhaustion, or it could be a sign of something more serious, like a fever, parasites, heart disease, or even poisoning. If your puppy is lethargic, I recommend checking their gums to make sure that they're nice and pink. If they're pale or white, this could be a sign of anemia or shock. Also, feel their belly to make sure that it's firm and not swollen. A swollen belly could be a sign of fluid retention or ascites, which could be caused by heart disease or liver disease. If your puppy is lethargic, anemic, or has a swollen belly, take them to the vet immediately. Those are 6 red flags that your puppy needs to see a vet. So how many of these did your puppy have? You let us know down in the comments below. For me, I'm guilty of taking my dogs to the vet way too much. For example, I took my old husky Tundra to the vet just about every month. My little guy would get so anxious in the car that he would throw up everywhere, so needless to say, he wasn't a big fan of going to the vet. But luckily, he never had any major health problems during his 13 years of life. On the other hand, my current dog, Maverick, has already been to the vet several times. He had his first set of shots, then he got his microchip. After that, he got neutered, and just recently he had surgery on his knee. Thankfully, all of these appointments went smoothly, and he's finally all grown up. Now he loves going to the park and playing fetch. Also, before we end today's video, I need to mention that I'm not a vet, and this video is for informational purposes only. So if you're concerned about your dog's health, please contact your vet for advice. That's all for now. Thanks so much for watching. Please consider subscribing, and I'll see you in the next video.